Welcome to SAT School. I am Sabina. This is our third video about nursing in Canada. If you have not watched the previous videos, please click on the I button above and watch the previous videos first. In this video, I'll explain different types of evidences to meet language proficiency for nursing registration in Canada. Let's get started. This is what we already discussed in the last video regarding the minimum scores in different language tests. It might be difficult to meet language requirement to some of the applicants, but do not be afraid. There are ways to meet language requirement. Other types of evidences to meet language requirements are additional nursing education, completion of non-nursing program, nursing experience, and non-nursing experience. Point to be noted, this may be different depending on provinces and regulatory bodies. To share my experience, I immigrated to Ontario, Canada. When I started my application at NNAS, I requested NNAS that I will submit my language requirement to College of Nurses of Ontario, CNO, the regulatory nursing body of Ontario. So I did not have to submit language tests to NNAS. This is the provision available for the Ontario applicants. So applicants other than the Ontario, please check with your regulatory bodies for detailed information. To meet language requirement, one of the ways is additional nursing education. If you are asked by a regulatory body to complete additional education to meet the evidence of practice requirement, or you completed other nursing education within the last 2 years in English or French, then regulatory body will consider whether that additional education meets the language proficiency requirement. The additional education must include a minimum of 200 hours of clinical instruction in the program, either in English or French. Primary language that was used for theory and clinical instruction should be English or French, or primary language of the educational institute was English or French, and the program was not exclusively on online or distance education. The next way is completion of non-nursing program. If you have completed a non-nursing program at college or university within the last 2 years in English or French, regulatory body will consider whether this education meets the language proficiency requirement or not. The education must meet theory, instruction, and clinical practicum or internship placement was provided in English or French. The primary language of the college or university was English or French. You completed a minimum of 200 hours in that clinical practicum or internship placement in English or French, and the program was not exclusively an online or distance education. Another way is through nursing experience. If you have worked or volunteered as a nurse in another province or country within the last 2 years in English or French, regulatory body will consider whether your experience meets the language requirement or not. The nursing experience should fulfill following requirements. Nursing services that should be provided in English or French. The primary language used in the practice setting was English or French, and the primary language of the patient population was English or French. Next, you can also meet language requirement through non-nursing experience. If you have a non-nursing work or volunteer experience within the last 2 years in English or French, regulatory body will consider whether your experience meets the evidence of language proficiency requirement. Your experience must meet the following criteria: your roles and responsibilities or services provided in English or French, and the primary language used by the organization or place where you worked or volunteered was English or French, and the primary language of the clients was English or French. Please remember, your roles and responsibilities enabled gave you a chance to use your reading, writing, listening, and speaking skills in different ways and in a variety of situations, including complex, demanding, and unpredictable situations. This is very important, and this is what your regulatory body will ask your employer in detail. Let's come to my journey. I also meet language requirement from one of the above types of evidence. During my registration process, I was a student at York University. I had already completed my 200 clinical hours. I sent a letter from university which was enough for meeting my language requirement. Point to be noted, regulatory body deserves the right to refer your application to the registration committee for review if it determines that any evidence of language proficiency you provide does not meet specified criteria. This much for today. Thank you for watching. We'll meet you in next video. Please do not forget to subscribe, share and like. Press the bell icon for notification. Take care.